Hello all, it's Vanessa Love. Oh good, these have a little bit less glare on them. Oh, I think I spoke too soon. I have a little bit of glare on them. I wonder if... Sorry about all of that. Just trying to figure out, there we go. Okay. Trying to figure out where the glare is and if I should still have my glasses on. Anyway, so this vlog educational program is about the benefits of art therapy. And I want to say beforehand, the reason that I want to talk about this is because I think that many people do not know the benefits of art therapy. Excuse me. Yeah, I'm not going to wear the glasses. And I think that the previous, there's been a lot of controversy with previous art therapists and really reaching out and like telling people about the benefits of art therapy. And I think also that people have to that people still have to knock on doors of the places where they want to practice. Like if you're really good with cancer patients or if you want to work with children, to really knock on doors and explain to them the benefits of art therapy. So going through the art therapy program, there's so many benefits. Like I wish that I could just like list all of these things where I'm just like, if you do art therapy, this could happen, this could be a benefit of that. But yeah, now I have to go through some of the stuff. All right. So, I think that the more people understand the benefits of art therapy, the more, people will think about if they would like to have an art therapist for their company. And hopefully if they do want an art therapist for their company, they understand that having a full-time art therapist will be beneficial instead of these kind of crappy part-time jobs. And I don't mean to like kind of crap on the part-time jobs, but I think that if more agencies understood the benefit of it, then like they would want to have an art therapist dedicated, so yeah, the reason why I thought this might be a good idea was because I started thinking about the part-time jobs that are out there, and it's just kind of like, $40 in the city for a part-time job as a creative arts therapist. Like, it's not exactly the best, and it's a part-time job. And the other thing is that there was that I've been treated badly by people that like I was really surprised that they were treating me so badly. And then there was someone who told me that they had worked really hard to get someone to get a position open for another art therapist at, I guess, their what is that called, at their placement, their place of work, their facility. And I was very critical of that opportunity because I thought it was a shit opportunity. So I had the experience one time of my friend reached out to me. She said, this group home wants an art therapist. You're an art therapist. Like, I don't know why they're not reaching out to you, but like, they want an art therapist. And I was like, okay. So I reached out. I had worked at this place before, so I knew the CEO, I knew who to contact, and the house therapist like got a hold of me, and I was like, well, that's really weird. Like, I don't think that the therapist there should have anything to do with my finances and what I might be paid for this. And after reaching out, emailing her, and all this stuff, she said that she really wanted me to volunteer for the position. And I was like, no, I'm not driving my ass over there, like, a 30-minute drive. So an hour round trip to be, to do a group with, this population and not get paid anything. I know that they would have provided supplies that would have been fine, but like, no, an hour drive of driving total, an hour of group and come back. No. And as I said, I had worked for this company before, so I knew that they had money. They could have paid me, and they chose for whatever reason not to. I don't know what that was all about, but I felt like, you know what, you go somewhere else. I'm good. Don't bother me. And then there was this other position in another state. So one of my friends on Facebook had shared it, and it was a group with senior citizens, and it was a 30-person group. You had to provide your own supplies. I think it was like $20, maybe $30 for the hour, and they were going to what was it like? They were going to if you needed like supervision for your like licensure, they would provide that. That was like, kind of the fringe benefit there. And I was like, I don't know who the hell you expect to apply for this job. Like, this is shit. If you know anything about group dynamics, a 30-person group is absolutely not going to fly. You will never get to know any of those people in 1 hour. You will never get them. You'll usually not get them to open up except for 1 or 2, maybe 3. You might get 5. But I mean, basically you would spend the whole time going around the room asking how their day is and then going, how do you think about what do you think about this group? Like that's probably as much as you're going to get. No, that's not good. That person really got upset with me when I did criticize that, because she had worked so hard, as I said, to get that position open. But again, I don't think that they understood the benefits of having an art therapist. Maybe they kind of did, but they didn't respect it enough to actually like give a shit about like providing for an art therapist and why this would not be an ideal situation. So yeah. Benefits of art therapy. Benefits of art therapy include things like if you're working with disabled people, or people with disabilities, that you're working on their dexterity. You're working on things that like will help them to like, if you can hold a paintbrush or a crayon, like one of the big crayons, like you can, hopefully like learn how to, brush your teeth too, like this movement, or, like holding on to, holding on to a brush can lead to other things, and definitely my experience is that the more that I painted, the better I got at chopsticks. Fine motor movements, fine motor movements. It's, very similar enough that my hands work better with that. I didn't learn how to use chopsticks until I was in my 20s. So there's that. So like that's one of them. It boosts self-confidence and self-esteem because you can see the progression of what is being done in therapy, and you can see how that person is changing, how they're expressing themselves, if there's any what is that if there's any repeat themes, repeat colors, that type of thing. So self-esteem, which would decrease the amount of depression, because if you feel like you're doing something, and you can see the results of what you're doing, because that doesn't always happen in therapy, then you might feel better about yourself. It decreases anxiety. Many people have experienced that with the coloring pages, like that relaxation activity. Some artists, and I've experienced this myself, you do artwork for so long that you get into a flow, and getting into the flow is like the best. I can't explain it. It's just, I think the comparison is to the runner's high, where it's just like you go and you go and you go, and then like it just feels like you're emptying yourself. Like there's just all of this stuff that you do in the middle of the flow, and you come out and you feel so much lighter, and you feel like so much has changed in those moments. And that also, I think, goes into this thing called felt sense, where like there's a felt sense of change within yourself, and you can't really like pinpoint it, but you know that it exists. So the felt sense of change. Let's see. It can decrease blood pressure. I've read that and if it decreases blood pressure, it can decrease inflammation and some pain. That's why, people who have experienced cancer, who are experiencing cancer, and what is that called? Chemotherapy, and some people who are in hospitals, they'll do that. It also creates a connection to the self. And some people just don't have that. There are plenty of people who have just kind of gone along and been told, like, you can't feel that way, or, whatnot. And so they end up having a disconnect between their feelings, their thoughts, what they feel is right, the like a little bit of like confusion and conflict within themselves. And so, bringing that back to themselves, having that connection to themselves. Some people who are spiritual have a connection back to their spiritual self, and feel, I've read a couple of case studies on this, of how people feel like they have a connection to God if they're doing their art. Some people just have that relaxation, which is completely fine. And there's so many people who have benefited from art therapy, and just about any person who you can think of, they've done study. Well, I've done the group and internship with veterans, so I know it works with veterans. They express themselves. It's amazing. And I've actually had a couple of veterans in private practice, and they do connect to themselves, and it is so wonderful. And like do these wonderful pieces. And I think a lot of people would think that they wouldn't do anything like that, but they do, and it's, oh my God, it's so wonderful. Athletes, to improve themselves, to improve their performances, actually. Less stress in your life, more likely that you're gonna like actually perform peak, right? So there's that. Doctors are doing it now so that they have better performances as well, and they're finding that works really well. Yeah, people with all sorts of diseases, even like the ones where like people can't like do too much because of the exposure to germs, the art therapists have found a way. I swear, they have found a way. And there are plenty. I think if you look up like the Google Scholarly, what is that called? Like journals and stuff, you'll probably find something about like computer art therapy for kids in hospitals, for adults in hospitals, for senior citizens, for hospice patients. All of these people who you think, oh, they would never be that into it, they're into it. And there's like a wealth of knowledge that comes out of that. And I think some people are like really happy to express themselves. They're like raring to go to express themselves. And I used to have a position at a hospital called rehabilitation therapist. We had a rehabilitation like department. And so that department had music therapists, occupational therapists, art therapists, and like just people who ran the groups. Everyone else, they ran the hospital, we ran the groups. So we would, bring up materials, bring up handouts, bring whatever we needed, whatever the group, idea was, go up there, do it. So as a part of that, I had the therapeutic rec group, and therapeutic recreation sometimes was just like, all right, I want you to just take 20 minutes and write about something that's important to you. If you want to turn into a poem, you can. I am by no means a poetry therapist, but one of the things that I just like to do to connect with the patients there. And you would not believe how many people just opened up, had all of these things where like I never knew what to expect. I really didn't. And like the people who I thought would never ever connect with it, always connected with it. And I'm like, oh my God, I've never heard this person have any creative expression in their life. Like I knew them pretty well, but like, didn't know that they could make a rhyming poem better than I could, like, so it definitely like can show that aspect of themselves. And sometimes they just express different things when they're, given the opportunity. And, it's really, really interesting to see what people will say when given the opportunity. And, things that they would never say in any like group, even if you ask them, like, do you think this was going on? No, no. And then like they go into the, you give them an open prompt, hey, do this thing. And they're like, okay, so this is totally what I felt about this thing that I never talk about. Like, this goes into your chart. We're going to talk about this, in the collaboration group, all of that stuff. Like, and again, the depth of knowledge that you get about a patient, a client, a person who chooses to do art therapy, it's so much more than just asking a question. It really does sometimes like just kind of open up a world for people. And I've seen it repeatedly where it's like, okay, do this thing. Oh my God, like that person, their demeanor changes, they're like brighter, they're like, I want to do this all the time, they get excited about it. And I don't know if that happens with any other type of therapy. Like, like you all can like message me directly, but like I don't think that happens in any other type of therapy. So this is why, you have to like, everyone who wants to be an art therapist, and every art therapist really needs to go out and like just really do outreach and like explain to people like there's so many benefits to art therapy. I promise you, if you have an art therapist on staff, you will be like you'll be blown away most of the time by the things that they will discover about people who you've worked with for a week, for every day for a week, for years. And it's never like, you might never like see that person the same way again, but like they might not have that, like they might not be the same after doing art therapy. Yeah. So definitely, I think more agencies should give it a try. Yeah. All right. Well, I hope that was helpful for you, and I will talk with you guys soon. As you know, I've turned off all comments for my page because after a while, they just didn't seem very productive. Got kind of tired of them. But you are always welcome to message me. YouTube has this new messenger, so definitely message me if you have any questions, and I will hopefully be around to answer them. Been a little busy lately, but I'm keeping it together. All right. I hope you all have a great day. Thanks so much.